Good day. I am a physician. These 5 blood tests could save your life. Your annual checkup gives you a basic panel, but it misses the most dangerous hidden diseases. There are 5 specific advanced tests that detect silent killers years before any symptoms appear. Almost no primary care doctor orders these tests unless you walk in and ask by name. Today, I am giving you that exact list so you can demand the science that saves lives. We assume a clean annual checkup means we are completely healthy and protected from serious disease. Standard screening protocols were designed decades ago for a population that lived only to 70. Today, the medical frontier has evolved, and the real killer-catching tests are rarely ever ordered. The standard lipid panel completely misses the single most dangerous inherited cardiovascular risk factor in medicine. There is a 3-month blood sugar window that catches diabetes years before a fasting test. Silent organ collapse can eliminate 50% of your kidney function without producing a single symptom. This video gives you the exact tools to stop passively accepting a basic checkup as protection. Number 5. Lipid panel plus lipoprotein. Your standard cholesterol test is hiding a deadly genetic time bomb. Your doctor orders a lipid panel and tells you your cholesterol levels are completely under control. That standard panel measures total cholesterol, LDL, HDL, and triglycerides. But it misses something critical entirely. It completely ignores the single most dangerous inherited cardiovascular risk factor in all of modern medicine. Lipoprotein pronounced Lp(a), is a genetically determined protein particle you must specifically ask to test. You can have a pristine LDL reading and still carry an elevated lipoprotein, destroying your vessels. The 2025 European Society of Cardiology now explicitly recommends measuring it at least once in every patient. If your lipoprotein A is elevated, your entire cardiovascular prevention strategy must fundamentally and immediately change today. One test, one number, one conversation with your doctor could completely redirect the course of your health. Number 4. Glycated hemoglobin HbA1c. The standard fasting glucose test is showing you only one single moment. The standard approach to diabetes screening is one single fasting glucose reading taken in the morning. If you ate lightly the night before, your blood sugar appears normal, even when chronically dangerous. The HbA1c test is fundamentally different because it measures a full 3 months of your biology. It measures the percentage of hemoglobin molecules permanently bonded to glucose over the preceding 3 full months. This provides an unforgeable rolling average of your actual metabolic reality over time, not just today. You cannot manipulate this number with a single light dinner the night before your appointment today. This one test consistently catches prediabetes years before a simple fasting glucose reading ever possibly would. That early detection gives you the critical intervention window to reverse the course before damage becomes permanent. Ask your doctor for HbA1c by name at your next appointment, not just fasting, glucose alone. If you find this science-based breakdown helpful, please click subscribe and tap the notification bell right now. It only takes absolutely 1 second, but ensures you never miss the next video in this series. Number 3. Creatinine and GFR. Your kidneys can lose half their function before you feel absolutely anything. Your kidneys are the most stoic and silent organs in your entire body, working without complaint. They will filter toxins and regulate blood chemistry efficiently, right up until the moment they catastrophically cannot. Chronic kidney disease can silently obliterate up to 50% of total renal function without symptoms. No pain, no change in urination, no warning signal of any kind reaches your conscious awareness. This is precisely why nephrologists consistently and urgently call chronic kidney disease the great silent killer today. A simple creatinine blood draw allows the laboratory to calculate your glomerular filtration rate, called GFR. That single number directly tells your doctor exactly how efficiently your kidneys are currently performing right now. This inexpensive test reveals exactly what your stoic and silent body is desperately hiding from everyone. Request creatinine and GFR together at your next appointment because your kidneys will not ask for you. We have covered the cardiovascular time bomb and the diabetes window and the silent kidney collapse. But a tiny gland at the base of your throat secretly controls your weight, mood, and heart.
Number 2, TSH, thyroid-stimulating hormone. Thyroid dysfunction after 50 is shockingly common and almost universally missed today.
Your thyroid is a small butterfly-shaped gland in your neck with enormous biological influence over everything. It directly controls your metabolic rate, body weight, emotional stability, heart rhythm, and internal temperature regulation daily. When this gland begins to malfunction after age 50, the symptoms are devastatingly nonspecific and misleading. Crushing fatigue, unexplained weight gain, persistent brain fog, dry skin, and chronic constipation are the common signs. Every single one of those symptoms gets casually dismissed by patients and physicians as simply getting older. One simple TSH blood test immediately reveals whether your thyroid gland is sluggish or dangerously overactive today. This condition is extraordinarily common in the aging population and is almost always completely and simply treatable. A single inexpensive daily pill can dramatically restore your energy, your metabolism, and your overall quality of life. Never let these symptoms be explained away as aging without first checking your TSH number by blood.
Number 1, vitamin D and vitamin B12. These two deficiencies are the great biological imposters after 50.
When vitamin D levels crash, the result is chronic bone pain, deep muscular weakness, and relentless fatigue. Approximately 70% of all adults over 60 are currently vitamin D deficient without knowing it at all. Patients present to their doctor, looking and feeling like they are simply aging rapidly and inevitably downward. When vitamin B12 levels bottom out, the neurological damage is even more insidious and dangerously misleading. Tingling in the hands and feet, cognitive fog, impaired balance, and dementia-like symptoms emerge without warning. Metformin, the most commonly prescribed diabetes medication worldwide, systematically depletes your body's B12 stores over years of use. Millions of diabetic patients are unknowingly accelerating neurological damage with a drug prescribed to protect their metabolism. Both deficiencies are diagnosed with a single inexpensive blood draw and completely corrected with simple supplementation today. Ask for vitamin D and B12 levels at every checkup, especially if you take metformin regularly.
The 5 tests we covered today are not exotic, experimental, or difficult for anyone to request. They are sitting in your local laboratory right now, available on demand for every single patient. Print this list, write it down, and bring it to your very next doctor appointment. Ask specifically for lipoprotein A, H-bound A1C, creatinine with GFR, TSH, and vitamin D with B12. It takes exactly 5 seconds to request these tests and could reshape your entire medical future. Stop passively accepting a basic annual checkup as comprehensive and sufficient protection against serious silent disease. Demand the science that actually saves lives and never leave that office without these 5 numbers. Subscribe, tap like, drop a comment below, and share this video with someone you love.